define love addiction. Now, I know you did this in your book, but I'm curious, like, current state.
Well, I'm going to get you involved in this discussion too. Do you mind?
Yeah.
How would you define love addiction?
So I think that you can be addicted to anything. Like, I could be addicted to this table that my laptop is sitting on if
I don't think you could be having a love affair in a table. I don't think they're in the same universe.
No, I agree, but I'm talking like bigger, like I could be addicted to anything if I'm constantly thinking about it, if it's interfering with my daily life. And so when it comes to love, I feel like you can be addicted to kind of that euphoria, like you get a high from thinking about like the romance of it all. There's fantasy involved, addicted to being in a relationship. I think it comes from a root of codependency left untreated.
Well, now we're getting in codependency left untreated. We're getting away from concrete things. Let's stay concrete. But I agree with you. It's interesting, the two things that you talked about, I think were interfering with your life and thinking about it all the time. Characteristics for being listed for any disorder in the DSM-5 are impairment and distress.
Mm-hmm.
So that's a pretty good starting place. If you say, well, if you want to evaluate a relationship and you go, well, is it helping me or is it impairing me?
Right.
And then next, does it make me feel better or does it generally cause me grief and anxiety?
Mm-hmm.
And I agree with you. I mean, you threw out the words codependence and therapy, but I would say people seek it as a way of compensating for some deficiency in their life. It may be a long-standing deficiency, some kind of deprivation in their soul, in their psyche,
Mm-hmm.
some kind of current, like they just moved and they're disconnected or they just got divorced. And so they have a hole to fill.
Mm-hmm.
And I agree, that's the definition of any addiction. Do you turn to something out of a sense of inadequacy, a sense of problems you're not able to address? But as a result of being in that involvement, does it actually worsen your situation so that you have to clutch that thing even tighter?
Right.
So I don't think that works with the table. So, I mean, you might like your table a lot. And if it got broken, you might be, oh, damn it. But I don't think you're going to clasp something as your whole life, unless it's something warm and fuzzy, like a human being.
Yeah.
Or a drug. But I think underlying both of those addictions is that the thing is able to give you a sense of being okay,
right,
temporarily, unfortunately. And when it's taken from you, you don't feel okay.
Right. Would you say it's a coping mechanism?
Yes, it's a dysfunctional coping mechanism. Yeah. But with the advent of harm reduction, we're a little more appreciative of not judging those things. For example, if somebody's addicted to whatever, drugs or alcohol, in the harm reduction framework, we're a little bit more careful of saying, oh, well, let's just eliminate that. And then what? And it's the same. Suppose there's a little old lady who's totally dependent on her housekeeper and says, where is she? And night and day. Mm-hmm. Well, it may not be an ideal situation, but you do think, well, it's not our job to just eliminate that dependency without the possibility or helping the person to build a better structure in their life.
Mm-hmm.
Where you're working as a therapist, that's where you're going. And I have the Life Process program. We try and build up the infrastructure of a person's life.